Hi, we're the Burn Special Care Unit Group, and our evidence-based practice project was on ventilator-associated pneumonia. Many of our patients in the BSCU have had neck surgeries which involve the use of ventilators and the insertion of tracheostomy tubes in order to keep their airways open so that they can breathe. Ventilation of a patient is considered an invasive procedure. The use of an endotracheal tube during general anesthesia and the insertion of a tracheostomy tube open a pathway for infection to travel to the lower segments of the lungs. Ventilator-associated pneumonia, or VAP, is pneumonia which occurs within 48 hours of a patient being mechanically ventilated. VAP is one of the most frequently occurring healthcare-associated infections in intensive care units. It causes patients to need to stay in the hospital longer, raises the cost for their health care, and doubles the risk of patient mortality. Because it is considered an HAI, insurance companies and Medicare do not reimburse hospitals for the care given for VAP. One of the major risk factors which can lead to the development of VAP in a patient with a tracheostomy is the colonization of the oral cavity with microorganisms which are not normally present. These microorganisms can travel down into the respiratory tract and then cause pneumonia. By doing frequent oral care as an intervention, nurses can reduce the amount of these microorganisms present. Oral care for patients can range from standard oral care, which may involve manual toothbrushing, moistened oral swabs and saline mincings, to the use of topical medications and oral decontamination using antibiotics or antiseptics, such as hydrogen peroxide or chlorhexidine gluconate. Our EBP project PICO question is, in patients who have tracheostomies, does the use of antiseptics and antibiotics for oral decontamination, in comparison to the use of standard oral care, cause a decrease in the incidence of ventilator-associated pneumonia?
What were our articles? All of our articles included random control trials. 2 of them were systematic reviews of randomized control trials. They were all high-quality articles. We used CINAHL and the Cochrane Library. These were our limiters. And these were our keywords. All of our articles are high quality. The 2 systematic reviews had all random control trials. The results were consistent and generalizable across the board. The articles we found are consistent. They all show how by using things like chlorhexidine and peroxide rinses, the rate of ventilator-associated pneumonia is decreased. Because all the articles have compelling evidence and consistent results that medicated oral hygiene was more effective at reducing the incidence of ventilator-associated pneumonia in ICU patients rather than the conventional oral care, our recommendation is that it would be best for all of the ventilated ICU patients to receive daily medicated oral hygiene rather than conventional oral care such as toothette oral swabs or water rinses. This will lead to positive outcomes in the ventilated patients by improving their quality of life, decreasing the number of days on the ventilator, reducing length of hospital stay, and reducing the treatment costs.